Okay, so we're going to be talking about compulsions. So eating disorders and compulsive sexual behaviors may be diagnosed as mental health behavioral conditions. They're using the American Psychiatric Association published diagnostic criteria, the Statistical Manual of Mental Disorders, otherwise known as the DSM-5. So to clear any terminology, I may be using mental health behaviors, mental health conditions, but they all relate to eating disorders and compulsive sexual behaviors that fall under the umbrella category, which is mental health. Okay, so starting off with media portrayal here. It is observed that there are negative portrayals of mental health behaviors throughout the media. Media can be described as mass communication through the internet, television, radio, newspapers, and various forms of printed media. Media portrayals of mental health behaviors are also observed to be a risk factor for exacerbations of mental health behaviors, such as eating disorders, addictions, and substance abuse. It has been shown that media portrayal of mental health behaviors have the ability to influence an individual's perception about mental health behaviors. The media have been also observed to associate negative attributes regarding mental health behaviors, such as being unlikable, dangerous, aggressive, violent, untrustworthy, and incompetent. Relatively, the media has also been observed to omit specifics regarding mental health behaviors, and that the media is shown to collectively combine mental health behaviors using depictions such as mentally ill or psychiatric patient. Thus, these negative depictions of individuals may have affected by mental health conditions or mental health behaviors are at increased risk to be viewed as negative from the public eye, leading to further distancing and stigmatization within the community. Regarding family support, it is described that family support is important for those with mental health behaviors. This is because family support has been observed to help during the treatment and recovery processes of an individual. Through engaging with their loved one, with health professionals, families can gain insight into how to spot specific signs and symptoms of a worsening mental health condition and how to provide support for the loved one. Regarding peer support, so a peer in definition is described to be an individual at the same level of another individual. In regard to mental health behaviors, support peers are individuals who have experienced the same issues, have gone through the same processes, and are currently recovering, most often. Support peers are then able to then provide insight and support to individuals seen as difficult to reach. It is observed that peer support helps improve overall quality of life in individuals with mental health behaviors, as support peers provide hope about recovery. Regarding political barriers, so it has been observed that there are several political barriers in regard to compulsive behaviors. It is stated that there is a high demand for health economic research on cost-effective interventions, limited government funding towards mental health services, and this includes the need to relocate away from limited resources in small towns and having individuals relocate into major cities in order for them to obtain the help they need. Public policies and overall global architecture needs to be restructured worldwide. Regarding potential barriers, community perceptions or stigmatization is one of the most important factors that can be described here for mental health. So mental health stigma can be defined as devalued, disgraced, or disfavored. Stigmatization of mental health behaviors may prevent affected individuals from seeking treatment, adhering to treatment regimes, and finding employment and living in communities. Mental health stigma is described to be the most important barrier to overcome in the communities. Regarding community perception, it is observed that individuals' perception through their knowledge of the cause of mental health behaviors are seen as a source of influence towards their willingness to associate and or seek relationships with individuals with mental health behaviors. Okay, so regarding race and region, first off, I'm going to be starting with the region. So American Indian tribes here in the United States are observed to not stigmatize mental health behaviors. Some may stigmatize mental health behaviors, or stigmatize all mental health behaviors. In Asian countries in relation, it is observed that many cultures in the Asian communities value conformity to norms. and that mental behaviors are perceived as shameful. Thus, individuals affected by mental health behaviors can't seek the help they need. In regard to race, however, European American individuals are described to view treatment as essential in regard to mental health, actively seeking treatment from mental health professionals and openly discussing positive and negative perceptions about mental health. In relation, African Americans and Latino individuals are both observed to discuss non-biomedical interpretations of mental health and are both less likely to seek treatment. Specifically, it is observed that African American individuals discuss the frustrations regarding mental health treatment derived from the distrust in the medical profession. And in contrast, Latino individuals perceive diagnosing mental health issues as socially damaging. In regards to religion, it is described that religion may have an influence on an individual's perception about mental health through introducing beliefs of causes of mental health conditions, and this may ultimately negatively impact an individual's willingness towards seeking medical help. On the other hand, being spiritually involved provides an individual with a sense of structure in their life and may have a positive effect in their management of drug, eating, and or sexual compulsive behaviors. Being involved in religion provides a community for an individual, and they can create connections with and find a sense of belonging with those in that community. Religion also provides those with mental health behaviors coping strategies through otherwise healthy religious rituals that are regular, structured, and otherwise predictable. Religion, lastly, also provides guidelines of importance on doing what is right and also embodying compassion, gratitude, and having life lessons that come with this. Regarding socioeconomic status, it is described that individuals who are poor are more likely and more vulnerable towards developing mental health conditions. And this is because it has been observed that poverty as a burden creates debilitating cognitive effects and may result in ineffective coping through developing unhealthy health behaviors. Mental health conditions create a cycle of poverty from an individual's ability to function in their income roles. It is described that those suffering from mental illnesses such as compulsive behaviors are often the poorest of the poor, and this is because their compulsions may negatively impact their economic status to occupy their compulsion and or their productivity in work roles, and this is due to their negatively being affected by their mental health behaviors. In regards to gender, when a patient is diagnosed with a compulsive behavior such as eating disorders or sexual addictions, it is important to treat that right away. The problem lies in gender bias for treatment from these types of compulsions. When dealing with sexual addiction, it is assumed that it will be men to have this compulsion. A woman with serious problem might have a difficult time getting an actual diagnosis and therefore might not be able to get treatment. While men are diagnosed with eating disorders, the fact remains that almost all residential treatment centers are for women. This makes it hard for men to get the same kind of treatment that women do, and this puts them at higher risk for serious health complications. In regards to geographical location and telehealth, there are few better treatments for compulsive disorders than intensive therapy with a trained and qualified therapist. This becomes tricky, however, when a person lives in a rural area that may have little to no local access to quality psychiatric care. These patients tend to live a somewhat more isolated life and may get diagnosed much later, if at all. They don't have the same number of people that might recognize their struggle. While telehealth could offer a solution to counseling services, it doesn't have just the same impact as having a person in the same room with the patient at the same time. In regards to implicit and explicit biases, so it is important for us people to understand that these compulsions are mental illnesses and that they are no lesser than schizophrenia, bipolar, or depression. Often there are biases towards these kinds of patients from the community or the people that surround them, and these people may think that these individuals aren't really sick, they must be looking for attention, and that they could really stop if they really wanted to. Many people also think that these individuals just want pity, and often looked upon with anger instead of care. It is often said aloud that those with a sex addiction are simply perverts who objectify women and that there is nothing that can be done to help them. People with eating disorders, relatively, are accused of being vain and not caring about anything but their appearances. In regards to regions not affected by these health disparities, in regions such as Europe, those with compulsive disorders are looked at as people who need treatment, and treatment is sought and available. There is much less stigma put on mental health than in the United States, and treatments are covered by their socialized health care. In areas in many parts, like in Africa, these kinds of compulsive behaviors have a much harder time developing due to their survival lifestyle. When a person's entire day is spent making sure that they survive, it is less likely that a compulsive disorder will develop. And this sums up our video. Thank you guys for watching.